Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering pediatric immunizations, and to be more specific, I'm going to go over the vaccines that we give to infants, okay? Now, if you haven't done so already, please like this video so you don't forget to do so. You know you're going to love the video, just like it now. Subscribe to my channel if you haven't done so already. Don't forget I have audio lessons available for you on my website, nexusnursinginstitute.com, and you guys can catch me, excuse me, covering a variety of nursing subjects almost daily on my other social media platforms such as TikTok, Instagram, and Facebook. So guys, without any further ado, let's get started. Start with immunizations. You see, I wrote no with 3 exclamation marks. So you know you have to know this information. When it comes to peds, vaccines are a big part of peds. And let me explain this to you. For NCLEX, NCLEX is very big on primary prevention measures. What's primary prevention? Education and vaccinations. We want to prevent things from happening. So they're big on it. So guess what? Your nursing exams, ATI, HESI is going to be big on that as well. So look at what it says. For the immunizations, recommended primary schedule begins during infancy, and with the exception of boosters, is completed during early childhood. Children who began primary immunizations at the recommended age but failed to receive all of the doses do not need to begin the series again, but instead they'll only have to get the missed doses. They won't have to start all over again. So let's start with hepatitis A virus. Hepatitis A virus is spread by the fecal oral route and from person-to-person contact by ingestion of contaminated food and water, and rarely by blood transfusion. This is important for you guys to know. Not so much for peds, but they ask you a lot on this on MedSurg, so I might as well highlight it. Make sure you know it. All right. How's hepatitis H transmitted by contaminated food and water? Rarely by blood transfusion, but it can happen. Hepatitis A vaccine is now recommended for all children beginning at 1 year of age. Remember, that's your 12 months, okay? The second dose in the 2-dose series can be administered no sooner than 6 months after the first dose. So once they turn 1 year old, we're going to give them that first dose, and you have to wait 6 months before they can get that second dose. It's important. I put a star next to it and make sure that you know that. It's recommended that newborns receive we're doing hepatitis B now, guys. So we're moving on from hepatitis A, we're on hepatitis B. It's recommended that newborns receive the hepatitis B vaccine. Look what it says, before hospital discharge. That's how important it is that they get that Hep B. We give it to that infant before they're even discharged from the hospital, okay? Before hospital discharge, if the mother's hepatitis B surface antigen negative. This has become customary. Unless the parents refuse, we make sure that that patient gets their Hep B right there in the hospital. Both full-term and preterm infants born to mothers whose hepatitis B AG status is positive or unknown, we don't know what the status is, they should receive hepatitis B vaccine and hepatitis B immune globulin within 12 hours of birth at 2 different injection sites. The Hep B vaccine is given intramuscularly in the vastus lateralis in newborns or in the deltoid for older infants and children. And the reason for that is the deltoid, that muscle really has not developed in the newborn. That's why you're not going to give it in the newborn. So in the newborn, look at where we do the IM, in the vastus lateralis, okay? Now it's only in the older infants and children that will do the deltoid. Regardless of age, avoid the dorsogluteal site because it's been associated with low antibody seroconversion rates, indicating reduced immune responses. The vaccine can be safely administered simultaneously, but at different sites with the Dtap, the MMR, and the Hib vaccines. So you can give them like at the same day. You can give them at the same time you're giving the injection sites, but you can't give them together, and it can't be at the same time at the same site, okay? It's going to be at separate sites. All right, we're going to move on to diphtheria. Now, this vaccine, diphtheria vaccines, commonly administered as follows. So we can get in a combination with the tetanus and the pertussis, combination with the conjugate Hib, and the combined vaccine with the tetanus for children younger than 7 years of age, or in combination with tetanus and your Tdap for children that are 11 or older. Or, it's either or. Look at the other option, guys. As a single antigen, when combined, antigen preparations are not indicated. Look, it says, although the diphtheria vaccine does not produce absolute immunity, protective antitoxin persists for 10 years or more. That is wonderful. And that's also important for you guys to know anyway. So for 10 years or more, when given according to the recommended schedule, and the boosters are going to be given every 10 years until they die. That's the schedule. It's good for 10 years, and then they'll get a booster for every 10 years. Tetanus. Tetanus. This provides protective antitoxin levels for approximately 10 years as well. Tetanus and diphtheria toxoids, along with acellular pertussis vaccine, are now recommended for children. This age, you guys need to know. Children 11 to 12 years of age who have completed the recommended Dtap DTP series, but have not received the tetanus booster dose. It's recommended that children receive subsequent, so after they get that first initial, that they get the subsequent TD boosters every 10 years, because remember, that's how long it lasts for, 10 years. Pertussis. Now, pertussis is a biggie, guys. Remember, with pertussis, we teach those parents to make sure anyone that's babysitting, the grandparents, family members who's going to be visiting the newborn has had their vaccine. Anyone with upper respiratory infection, make sure you keep them away from the baby. All right, pertussis vaccine. Pertussis vaccine is recommended for all children 6 weeks to 6 years of age up to the 7th birthday. But here's the key: who have no neurological contraindications to its use. We're still talking about the pertussis. It's usually given at 2, 4, and 6 months of age with the Tdap. That's important. You have to know that schedule, and that's usually given with the Tdap. Healthcare workers who may be susceptible to pertussis as a result of waning immunity and who have potential exposure to children or adults with pertussis should receive a single dose of Tdap and take the necessary protective precautions against droplet contamination. That's how it's spread. Wear procedural masks or surgical masks and practice hand washing. Polio. All children should receive 4, you guys need to know that, 4 doses of IPV at 2 months, 4 months, 6 months, and 18 months, and 4 to 6 years of age. Measles, we're down here, measles. Measles Rubiola vaccine is given at 12 to 15 months of age. The second measles immunization is recommended at 4 to 6 years of age, around the time that they're going into school. And that's actually one of the vaccines that they have to get into the public school system, okay? But it may be given earlier, provided that 4 weeks have elapsed since the previous dose. So 1 month, 4 weeks have to have gone by from that first dose and the second dose. Any child who's vaccinated before 12 months of age should receive 2 additional doses beginning at 12 to 15 months. They mentioned that already, and separated again by how long? 4 weeks. Well, guys, this is interesting because they just told us this information down here, right? Why are they saying it again? Because it's important. Most likely, this is going to be a test question if you're taking peds and you're on the area where we're doing immunizations. Make sure you know it. I suggest you guys use drug cards just to memorize it. The MMR, that's your measles, mumps, rubella, varicella vaccine, is an attenuated live vaccine, live because especially the varicella, live vaccine, and it may be given to children 12 to 15 months of age, but and before 4 to 6 years of age, concurrent with other vaccines. Children with immune deficiency should not receive the MMRV. They just told us that this thing is live. So you think somebody who's immunocompromised can get anything that's live? Absolutely not. So any patient with immune deficiency, such as HIV/AIDS, patient who's on chemo, radiation, that something has caused them to be immunocompromised, organ transplant recipient, right? They can't get a live vaccine. Children with immune deficiencies should not receive MMRV vaccine because of lack of evidence of its safety in its population. Again, remember, it's live. Mumps. Mumps virus is recommended for children 12 to 15 months of age and is typically given in combination with the measles and rubella. And it makes sense, guys, because these vaccines are given between 12 to 15 months of age. It should not be administered to infants younger than 12 months of age. And that's why they said 12 to 15. If it was younger than 12, they would say less than 12, right? 12 to 15 months of age, make sure you know that. Rubella. Rubella immunizations recommended for all children, again, 12 to 15 months of age at the age of school entry or 4 to 6 years of age. Increased emphasis should also be placed on vaccinating all unimmunized pre-pubertal children and susceptible adolescents and adult women in the childbearing age group. Post-pubertal females without evidence of rubella immunity should be immunized unless they're pregnant. Pregnancy is a contraindication, but unless they're pregnant, they should be immunized. They should be counseled not to become pregnant for 28 days after receiving the vaccine that has the rubella in it. And I wrote the reason why. You see what it says? It crosses the placenta. My book is not cooperating with me today. Right now. All right, now we're going to go over the pneumococcal vaccines. A 13-valent pneumococcal conjugate vaccine, that's the PCV13. It's 13 because it's a 13-valent, okay? The PCV13 has been licensed for use and is currently recommended as the standard pneumococcal vaccine for children 6 weeks to 24 months of age. That pneumococcal vaccine is for what? Strand of what? Pneumonia, okay? Children who have started the PCV series with PCV7 may complete the series with PCV13. PCV13 is administered at 2 months, 4 months, and 6 months of age, with the 4th dose at 12 to 15 months of age. A single supplemental dose of PCV13 is recommended for children 14 to 59 months of age who have received age-appropriate PCV7. PCV13 is also recommended for children younger than 24 months of age and for children, older children 24 to 71 months of age with sickle cell disease, functional or anatomic asplenia, nephrotic syndrome, chronic renal failure. There's a whole list. I'm not going to read it all to you guys. You guys can see this on yourself. You can see it for yourself. However, they can still get this. Let's move on to the flu, type B. Haemophilus influenza type B. Meningococcal have been licensed for the administration to children 6 weeks to 18 months of age, and it provides protection against meningococcal infections. Meningococcal is administered in 4-dose series. Again, your 2 months, your 4 months, your 6 months, and your 12 to 15 months of age. All HIP vaccines are administered IM and using separate syringe at different sites for any concurrent vaccination. So it's not contraindication that they get the other vaccinations. You're just going to give it at a different site. You're not going to give it at the same site. Nursing alert. The use of meningococcal and diphtheria proteins in combination vaccines does not mean the child receive enough immunization for the meningococcal or diphtheria illnesses. The child must be given the appropriate vaccine for that specific disease. Varicella Chickenpox. A single dose of 0.5 milliliters should be given by sub-Q injection. Well, this is something different because these vaccines we've been talking about, IM. But varicella says what? How are we giving it? Subcutaneously. Pay attention when you guys see something different from the rest. So it's given subcutaneously. The first dose of the varicella vaccine is recommended for children 12 to 15 months of age. And to ensure adequate protection, a second varicella vaccine is recommended for children 4 to 6 years of age. That second varicella vaccine can be administered before 4 years of age as long as a period, as long as a period of 3 months occurs between the first and the second dose. There has to be a lapse of at least 3 months between the two doses. Varicella vaccine can be administered at the same time with MMR. However, look at what it says, even though it can be given at the same time, separate syringes and injection sites should be used. If they're not administered at the same time, the interval between administration of varicella vaccine and MMR should be at least 1 month. Varicella vaccine can also be given at the same time with the Dtap, IPV, Hep B, or Hib vaccines. Influenza. The influenza vaccine is recommended annually, every single year for children starting at 6 months of age. That is, in peds, you have the influenza that let me back up. Let me not say peds. You have the influenza vaccine that you give to adults, and then you have the peds influenza. So this is what they're talking about, the peds influenza, that as soon as they turn 6 months, they can get. It's given IM. The IM vaccine is administered at 2 separate doses, 4 weeks apart. So that it's 2-dose series, but it has to be 4 weeks apart, 1 month apart, in first-time recipients younger than 9 years of age. The dose is 0.25 milliliters for children 6 to 35 months of age and 0.5 milliliters for children 3 years of age or older. The vaccine can be given at the same time with other vaccines, but it has to be separate in a separate syringe in a separate site. Oh. Am I still talking about my influenza? Yes. For influenza, it's recommended that an assessment of an egg allergenic reaction prior to making a decision about the vaccine administration to children who have a history of egg allergy. And the reason for that is there's a portion of egg that is used in that vaccine. I don't know exactly which, but you want to make sure a patient doesn't have an egg allergy before they get that vaccine. Remember, that vaccine is given every year. Yearly influenza vaccine should be administered to healthcare workers and children 6 to 59 months of age with medical conditions, including asthma, heart disease, HIV, diabetes, sickle cell disease, any disorder or disease that can place them at risk for influenza-related complications. They need to be the first ones in line getting their flu shot. Meningococcal infections. Infants younger than 1 year of age are especially susceptible, yet the highest fatalities occur in adolescents. There's also evidence that the risk of There's also evidence that the risk for meningitis infections is high in college freshmen living in dormitories. That is absolutely true. Those risk factors for the adolescents, the older adolescents around 15, 16, 17, 18, those college freshmen living in dormitories, or people who are in the army who are living in barracks, or people who are in prisons, anyone that's living in close confines with a whole bunch of other people, they are at risk, okay? It is not recommended that children 9 months to 10 years of age routinely receive the meningococcal conjugate vaccines because infection rate is low in this group. We really don't see it until they're like middle to later adolescent. That's when we start to see the risk increase for meningitis. Children and adolescents 11 to 12 years of age should receive a single immunization of the MCV4 and a booster of the same at 16 to 18 years of age. Others at high risk who should receive the MC4 include the college freshmen living in dormitories and military recruits. Why? Because they're living in those barracks with a whole bunch of other people. That places them at increased risk. Immunization with MC4 is contraindicated in people with a hypersensitivity to any of the components of that vaccine, including diphtheria toxoid and to rubber latex, because that's part of that vial stopper for the vaccine. That's important to know. You see, I put a star next to it. Don't say I didn't warn you. Recommended selected immunizations. The vaccine, we're talking about HPV, the vaccine's administered IM in 3 separate doses. The first dose in the series can be given at 11 to 12 years of age, but the youngest that they can be for that HPV vaccine is 9. That's the youngest we can give it to, okay? And the second dose is administered 2 months after the first. So we give it, the first dose we give between 11 and 12 years of age, and we have to wait 2 months before we give the second dose. The third dose being given 6 months after the first dose. Make sure you know that. Reactions. A recent systemic review concluded that there was no link. No, nada, nothing, zip, diddly squat. No link between autism and the MMR vaccine. You have to teach that to the parents. And unfortunately, because I've dealt with it too, and I have my parents, and I tell them, don't take my word for it. Go check the CDC. They don't even trust the CDC. So at that point, I don't know what to tell you. However, you still have to educate them, whether they want to believe you or not. That's their business. However, it's your job to educate them that there has been no link, and research after research after research has come up with the same conclusion. Moving on. With inactivated anti-agents such as Dtap, side effects are most likely to occur within a few hours or days of administration, and they're usually limited to local tenderness, erythema, swelling at the injection site, low-grade fever, and behavior changes such as drowsiness, fretfulness, them eating less, or crying a little bit more. Safety alert. Emergency management of anaphylaxis. Now, guys, there's allergic reaction and there's anaphylactic reaction. And anaphylactic reaction, that is a life-threatening reaction. That patient breaks out in hives, their throat closes up, they can't breathe. They're going to need epinephrine. So make sure you know this, emergency management for epinephrine. The drug, epinephrine, 0.01 milligrams per kilogram. So you have to take the weight of that child divided by 2.2. That's how you get the kilograms from pounds to kilogram. Divided by 2.2 to get the kilograms. So it's 0.01 milligrams times the kilograms of 1 milligrams per milliliter solution up to a max of 0.3 milligram dose. Okay. And the Epipen Junior, that is the one we give to the kids. Contraindications and precautions. Unfounded fears and lack of knowledge regarding contraindications can needlessly prevent a child from having protection from life-threatening disease. So I cannot stress this enough, how important it is to educate the parents on these vaccinations. Ask them if they have any questions, answer them the questions, and guide them to the research, guide them to the CDC so they can see for themselves what the CDC has to say about these vaccinations, precautions, contraindications, adverse effects, everything. The general contraindication for all immunization is, look what it says. It could have just said febrile, right? But they put a word in front of it, severe febrile illness. That's a contraindication. The patient has a severe fever, very high fever. This precaution avoids adding the risk for adverse side effects from the vaccine to an already ill child or mistakenly identifying a symptom of the disease as having been caused by the vaccine. So the kid already had this fever, and now the parents are thinking the vaccine made them sick and not wanting to give the kid any other vaccine. So it's very important. That's why we just use it just as a precaution. The presence of minor illnesses, such as the common cold. This is not a contraindication. So if the child has a cold, they can still get their vaccines. Live virus vaccines, make sure you know this, I put a star next to it. Live virus vaccines, such as varicella and MMR, should not be administered to people who are severely compromised. They said this to us already. Why are they saying it again? Because it's important. Most likely you're going to see that's a test question somewhere, okay? Another contraindication to live virus vaccines, such as the MMR and varicella, is the presence of recently acquired passive immunity through blood transfusion, immunoglobulin, or maternal antibodies. If it's new to them, we're still not going to give them that live vaccine. Administration of MMR and varicella vaccines should be postponed for at least 3 months after passive immunization with immunoglobulins and blood transfusions have occurred. A final contraindication is a known allergic response to a previously administered vaccine or a substance in the vaccine. Remember, guys, we talked about certain things that can happen, such as slight lethargy, drowsiness, them crying. That's not enough of a contraindication. Okay, we're talking about a true allergic response. An anaphylactic reaction to a vaccine or its component is a true contraindication. Pregnancy, I put a star next to it, make sure you know it. Pregnancy is a contraindication to MMR vaccines, although the risk for fetal damage is primarily theoretical, but still, we're not going to take any chances. If she's pregnant, it's a contraindication. Breastfeeding is not a contraindication for any vaccine to the mother. I'm lying. Breastfeeding, because some do go through the breast milk. Breastfeeding is not a contraindication to any vaccine to the child, not the mother. Just joking, guys, to the child, Okay, lastly, let's talk about communicating with parents about immunizations. And I feel very strongly about this because, guys, this is my specialty, okay? I specialize in pediatric patients. I feel very strongly about it. It's very important that you educate the parents because a lot of times the reason the parents are refusing vaccines is because they're afraid. They hear so much on the internet. Well, they read so much on the internet and they hear things from friends and they really don't know. So it's your job as a healthcare professional to educate them and to empower them to educate themselves to go to reliable sources where they can learn about these vaccines. I'm not going to read all of these, are just the most important ones. Avoid judgmental or threatening language. That's not going to help you get that child the protection that they need against these viruses, against these illnesses, okay? Give the parent the vaccine information statement. That's the VIS, and the VIS that's provided from the CDC. Give the VIS beforehand and be prepared to answer any questions that may arise. Be flexible and provide parents with options regarding the administration of multiple vaccines, especially in infants who must receive multiple injections at 2, 4, and 6 months of age. Involve the parent in minimizing the potential adverse effects of the vaccine, such as administering an appropriate dose of acetaminophen, that's a Tylenol, 45 minutes before administering the vaccine, etc. Get the parents involved. And guys, this is the end of the video for vaccinations for the infant. Please, in the comment section, let me know what you thought about this video. Let me know what you'd like to see me cover more of. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And don't forget to check me out on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.